If you've had bleeding after menopause, I know exactly what happens. You Google the word and cancer appears, and your mind straight goes to the worst case scenario. In this video, I want to do exactly the opposite. My name is Mr. Saurabh Phadnis. I am a consultant gynecologist and gynecological oncologist working in London. I see women with variety of gynecological cancers including uterine cancer, cervix cancer, ovary cancer, vulval cancer. Bleeding after menopause. When should you worry? Postmenopausal bleeding is any bleeding that occurs after a gap of no periods for more than 12 months. This is because menopause is defined as absence of periods for 12 months, and any bleeding after that is then called postmenopausal bleeding. Postmenopausal bleeding does not mean that you have cancer. Often, when we investigate postmenopausal bleeding, 9 out of 10 times we will not find a cause for the bleeding or anything sinister like cancer. But if we do find cancer, it's usually early stage and it's completely treatable. Therefore, we take this symptom very seriously. Even light bleeding, an episode of spotting, counts and needs to be investigated thoroughly. This is a very important symptom, but there is no reason to panic. When you have any light bleeding or bleeding after menopause, please consult your medical doctor. Normal test, but still bleeding? This might explain it. The most common cause of postmenopausal bleeding is not cancer, actually. There is a very simple explanation. Often, after menopause, there is lack of estrogen hormone that makes the skin of the vagina brittle and fragile. There could be simple explanations other than that, like polyps or fibroids. Polyps are nothing to worry about. Polyps are localized thickening in any lining from an organ. Usually, polyps are found commonly in the intestine or even in the nose. If you have a polyp in the nose, you can snore. Similarly, thickening of the lining of the uterus, endometrium, can give rise to polyp. Or even the thickening of the lining of the cervix can give rise to cervical polyp. Fibroids are benign muscular lumps coming from the muscular part of the uterus. These are extremely common. Most fibroids do not cause any symptoms. When fibroids are larger in size, depending on their location, before menopause, they can cause heavy and painful menstrual bleeding. If you're on hormone replacement treatment or on blood thinners, that's another reason why you can have bleeding after menopause. Very rare causes are infection and inflammation. All these causes are benign and can be treated. So, not necessarily when you have bleeding after menopause, it is all sinister. Spotting that stopped on its own after menopause. Here's why it matters. I hear this often from women who present with postmenopausal bleeding. It felt like a period. It lasted for a few days. There were some clots associated with it. It is important that you give this history to your clinician. Many women have just light bleeding or brownish discharge. We cannot judge the seriousness of the matter just based on the lightness or heaviness of the bleeding or the color of the discharge. Every little bleeding or heavier bleeding needs to be investigated appropriately so that we are reassured that there is nothing sinister going on. When you meet your clinician with regards to postmenopausal bleeding, you will be asked questions regarding the episode itself. How long did it last? How heavy it was? Did you need to use any sanitary products? Did it cause pain? All these aspects are important. They are important in judging the seriousness. Although for every episode of bleeding, appropriate investigations will be necessary to reassure ourselves. Can you tell cancer bleeding by its color? Most women who present with postmenopausal bleeding do not have cancer. We take every episode of bleeding seriously and investigate it thoroughly. Most of the causes of postmenopausal bleeding are benign or not sinister. But when cancer is found, it is usually cancer arising from the lining of the uterus or endometrium. This is usually found in early stage and completely curable, and therefore investigations in that direction are necessary. Occasionally, Postmenopausal bleeding may arise from cancers that are arising from the lower genital tract, such as the cervix, vagina, or even the skin of the vulva. If this is detected in early stage, then it's completely curable. Therefore, if you present early, we can offer you appropriate treatment to get rid of the cancer. Cancer bleeding has no specific color or pattern. Therefore, it is important that we take each episode seriously and investigate it appropriately. Because if we find a cause for bleeding, and even if it's cancer, we can treat it with a high cure rate. Any bleeding after menopause, this is a sign to see your doctor. This is my simple rule as an oncologist. If there is any bleeding from the vagina, you need to take it seriously and seek medical help. It is because when investigated appropriately, we can either reassure you that there is nothing sinister going on, or if we do find early stage cancer, it can be completely treated with curative intent. This includes any vaginal bleeding. That may include vaginal spotting or a little bit of bleeding after sexual intercourse, or when you have bleeding whilst you're doing exercise or jogging. If you have any bleeding that is brownish discharge or repeated episodes of bleeding, even when you have had many years of low periods, these are all signs and symptoms that need to be taken seriously. You are not overreacting. Please do not think that you're wasting our time. Even a little bit of bleeding, we take it very seriously and offer you appropriate investigations. Postmenopausal bleeding, what to expect at your first appointment. At your first appointment, we usually take a thorough history. That would include your general medical history, specifics of the episode of bleeding. How much was it? How many days did it last for? Was it light? Did you use any sanitary products? Was there any pain? Are you on any particular medications like blood thinners? Are you taking hormone replacement? After taking thorough history, the first investigation that we offer you is an ultrasound scan of pelvis. The ultrasound scan of pelvis often is done as an internal ultrasound scan because it gives us a closer look at the uterus and the inside of the uterus, particularly the lining of the uterus or the endometrium. Endometrial thickness is measured, and if it is more than the threshold, then we offer you further invasive investigations such as hysteroscopy or a biopsy. Hysteroscopy is an examination that enables us to examine the uterine cavity using a very small, fine endoscope. About 8 in 10 women tolerate it very well in the outpatient setting. Of course, you have got a choice of having it under anesthetic. A biopsy may be necessary not only for reassurance but to exclude any sinister cause. Life after postmenopausal bleeding, what to expect? After investigation for postmenopausal bleeding, if we do not find anything sinister, then life returns back to normal. We usually ask you to keep an eye on your symptoms. If your symptoms are persistent, then you should report back to your GP or clinician. If cancer is found, then cancer is completely curable if found in early stage, and appropriate treatment will be offered to you. Follow up after cancer treatment is structured and supportive, and no one is left without any answers. We always take symptoms like postmenopausal bleeding seriously because early checking means either peace of mind for you, or if we find sinister cause, then it's completely treatable. This system works best if you report your symptoms early.